Uh, what, how has the landscape for the chronically ill changed in the last few years or since you first began writing about chronic invisible illness?
I would say it's been dramatic. I don't think that the quality of care and the frustration that chronically ill patients face is that much different. But what we found when the first book came out in 2005, we immediately began to be invited to patient conferences, small groups, small local support groups, national conferences, conferences put on by hospitals. And we spent 5 years traveling around the country, speaking to audiences, and of course, learning so much more about what patients were going through, which we used in the second edition. When this edition came out, we learned quickly that patients were online. They were speaking to each other through social media. Those support groups that used to meet, that patients had to, travel from Los Angeles to Chicago to meet with other patients with an illness like their own, weren't having to do that anymore. They had support groups online. There was blogging. I think there is a mixed blend. I think it's fantastic that there is so much support from the online community. On the other hand, the information that's out there is not vetted in the same way it would be vetted by a national patient organization or a national healthcare organization. So I think patients have much more access to information and support, but need to be more vigilant in making sure what is accurate in their case. The other thing I find, especially with chronically ill patients and chronic pain patients, is the degree of rage and frustration at not being able to access effective treatment, not be believed by physicians, is loud online, and it's less loud when you're dealing with it by yourself. So that is a bit of a mixed blessing. I find that I access these sites and learn a great deal from them, but there's a point at which I have to back away because it just becomes very discouraging for chronic pain patients in particular.